Hey, good morning, and welcome to the Patient Podcast. I'm your host, Vic Senese, coming to you every Saturday at 10:30 a.m. Central Time. If you're watching us live, you can watch us on YouTube, Facebook, LinkedIn, X, and we added Kick, so you can even catch us there. So everywhere we're able to find our spot in social media, we're going to be there for you. Now, if you're visiting us for the first time, be sure to check out our website at uropatient.com. Best place to learn more about the show. Also, best place to go and watch all the old episodes. We got a whole bunch of them there. And it's the best place to go and get our handouts, free handouts. What could be better than free? Going to see your doctor, download a handout, bring it along on your meeting. You'll be thanking me for it later. So we got a great episode for you today. Join us next on uropatient.com. Today, we're going to talk about nocturia, why it happens, what it means, and most importantly, what you can do about it. So nocturia is simply the need to wake up at night to urinate. Even once a night can disrupt sleep, but some people wake 2, 3, even more times. It's very common, especially as we get older. But that doesn't mean you have to live with it. Now, nocturia is a very common condition. It affects millions of people worldwide. It becomes more prevalent with age, as I just mentioned. Studies show that about 1 in 3 adults over the age of 30 experience nocturia at least once per night, and the frequency increases significantly after age 50. In fact, more than half of people over 60 wake up 2 or more times a night to urinate. While that's often thought of as a normal part of aging, nocturia can also be a sign of an underlying medical condition and should not be ignored, especially if it disrupts sleep and impacts daily life. And a lot of studies coming out there that say how important it is that we get a full night's sleep. Now, it happens when your body produces more urine at night than it can comfortably hold, and when your bladder's ability to store is reduced. As we age, our bodies naturally produce less of the hormone that concentrates the urine at night. Now, that's key. So normally, one of the reasons we don't get up at night is that our bodies don't make as much urine. There's a hormone that kind of turns the kidneys down so they're not going as much. Other factors that can cause nocturia, though, also include things like overactive bladder, where your bladder just doesn't want to store. And enlarged prostate in men can cause that to not empty out all the way. Fluid buildup in the legs that shifts when lying down. So sometimes you may notice that your legs are swollen, but when you go to sleep, the swelling goes away. Well, the body's got to get rid of that water. Certain medications like diuretics, which help get rid of that water, and underlying conditions like diabetes, which can make you produce more urine, heart failure, or sleep apnea. So understanding the cause is key to finding the right solution. So what causes this? Well, I kind of mentioned earlier that medical causes like the prostate enlargement, overactive bladder, diabetes, sleep apnea, heart problems, and even medications can cause it. And that's why it's so important that we get down to what it is. So why does it matter? Nocturia isn't just annoying. It can have real world consequences. Getting up at night increases your risk of falling. You know, falling can be one of the number one causes of death, because of all the stuff that it, ends up causing. You go in, you have surgery, surgical risk, can form blood clots as you're healing, all that stuff. Research shows that consistently getting too little sleep, having interrupted sleep, or suffering from conditions like sleep apnea may increase your risk of high blood pressure, irregular heart rhythms, heart attacks, and even heart failure. When you don't sleep well, your body stays in a state of stress, raising hormones that strain your heart and blood vessels over time. Taking steps to improve your sleep is not just about feeling rested, it's a vital part of keeping your heart healthy. So remember that. So what are these hormones we're talking about? Well, hormones play a crucial role in regulating sleep, and imbalances can significantly affect how well you sleep. One of the most important hormones for sleep is something called melatonin. It's produced by a little gland called the pineal gland in response to darkness. It gets dark and you produce it. Melatonin signals your body that it's time to wind down and helps you fall asleep and stay asleep. Other hormones also influence sleep, like cortisol, Cortisol is that stress hormone I talked about. It should naturally drop at night so that you're more restful and able to sleep. But if it stays elevated due to stress or other factors, go to bed with a lot on your mind, it can make falling or staying asleep very difficult. Growth hormone, which helps repair tissues and support health, is released mostly during sleep, deep sleep. So that's why it's very important. If you're not getting a full night's sleep, you're not making those necessary repairs. That's why we sleep. In aging adults, levels of melatonin and growth hormone tend to decline, which may contribute to lighter, more fragmented sleep. Likewise, shifts in estrogen and progesterone in women during menopause or testosterone in men can also lead to sleep disturbances. In short, hormonal balance is essential for good sleep. Whether from stress, aging, or medical conditions, they can lead to insomnia or poor quality rest. Now, when is it time to go see the doctor? If you're getting up more than once a night or having trouble falling back asleep, or notice symptoms like pain, blood in the urine, or an urgent feeling, that's the time to get to the doctor. So how do we diagnose this? So your doctor may ask about your symptoms and take a medical history, do some simple tests, and sometimes ask you to keep a bladder diary, writing down how often you go, how much, and when. Bladder diary is the easiest thing in the world you can do that gives a lot of great information. It's very useful, simple, and low cost. Provides valuable insight into your urinary habits and symptoms by recording when, how often, and how much you urinate, as well as, and this is key, the fluid that you take in and any episodes of urgency, leakage, or nocturia. It gives both you and your healthcare provider a clear picture of what's going on. I've had patients that have done a diary, and when they bring it in and we review it, I find out they're drinking way too much water. I mean, I know it's people tell you drink a lot of water, but some people take it way too much to heart. Just cutting back on the water was all it took. Bladder diaries help identify patterns, excessive fluid intake, like I just talked about, overactive problems like an overactive bladder, or increased urine production at night. They can distinguish between problems like frequent small voids versus normal voids with high nighttime production, which helps guide the right diagnosis and treatment. Remember, I said that the hormone doesn't always work to shut down the kidneys so they don't make as much urine. Well, if we see that the person isn't taking in too many fluids, too excessive, or too late at night, but they're still making a lot of urine, a lot of volume, that's the trouble. So we can go and identify the problem, you can fix it. In short, a bladder diary turns vague symptoms into measurable data, making it easier to pinpoint and create an effective treatment plan, especially for conditions like nocturia, incontinence, and overactive bladder. Now, the good news is there are many things you can try. These are what we call lifestyle changes. Cut down on fluids a few hours before bed. Avoid that cup of coffee or tea, because they're both high in caffeine, and alcohol late at night. Try elevating your legs in the evening to help that fluid shift occur earlier so that you get rid of that fluid before you go to sleep. Keep an eye on your salt intake. Salt intake makes you store more. So all those things can help. Simple things. Medical treatments. So there's a couple of medicines available depending on what the problem is. One of the things is to try to shut those kidneys down so they don't make as much urine. And that's a chemical called desmopressin. Now, desmopressin comes in a couple different formulations. There's a drug called Noctiva, which is like this guy we see in the picture using a nasal spray, is treated, you're administer it by nose spray. It's specifically FDA approved to treat getting up at night due to polyuria, making too much urine in adults. So you have to have the problem to fix the problem. Remember that diary I told you about. Now there is a pill. It's oral disintegrating tablet called Nocturia. And it's also FDA approved medication used to treat the same issue, making too much urine, that polyuria we call it. And it mimics that natural hormone vasopressin, which should cut down the production of the kidneys overnight. Taken once daily, about an hour before bedtime. It's available in 2 different doses. It can be very effective, but these require monitoring of sodium levels because it can drop your sodium level, which can be dangerous. So you got to make sure that you're having somebody watching all your labs and things if you're starting on these drugs. Another drug that we kind of hear about is melatonin. What's melatonin? We talked about it, that thing that's made by the brain's pineal gland. It's natural, and it helps regulate the sleep-wake cycle. So, you could take melatonin as a supplement. And some studies suggest that melatonin supplementation can reduce nighttime urination by improving sleep quality and potentially influencing bladder function and urine production during the night. So it just makes sense. If you're a light sleeper, not getting sound sleep, and you feel, oh, my bladder's a little bit full, you're going to get up to empty it. If you're in a deep sleep, you probably can ignore it. While it's not a primary treatment for nocturia, melatonin may be beneficial for patients whose nocturia is related to insomnia or circadian rhythm disturbances, particularly older adults with reduced melatonin levels. That circadian rhythm, that normal pattern that we get into, that one bugs me the most because the changing with the longer daylight and shorter daylight and stuff like that really affects me. Maybe it does you too. Melatonin is generally considered safe for short-term use even in older adults, and it has a low risk of dependence or serious side effects. Long-term safety data, however, is still limited, especially in children and people with chronic health conditions. It also interacts with some medications, so that's got to be careful. If you're on blood thinners, immunosuppressants, diabetic drugs, or anticonvulsants, it does interact with those. As with any supplement, important to consult a healthcare provider before starting melatonin, especially for managing nocturia or sleep issues in older adults. Well, what are some other things we can do? We can just improve our sleep habits, what we call sleep hygiene. It can also help. Go to bed and wake up around the same time. So you kind of condition yourself. That's what you got to get used to. Wind down before bed. Do things that are going to relax you. Put away the things like your iPads and iPhones and things, especially the ones that are putting a lot of blue light out, because that stimulates your brain. You want to start, winding down. Read a book, whatever. Do whatever it takes to wind down. Make your bedroom as comfortable and quiet as possible. You don't want that to be, the place that you gotta, a lot of people have TVs in their bedroom. Bad idea. I'm guilty of it too. Your heart will thank you for it. Remember what I said. You don't get that good night's sleep, you're putting your heart at risk. All right, so to sum things up, nocturia, common, but you don't have to put up with it. Many people find relief with some simple changes, and if needed, medical treatments are available. Most important step is to talk to your doctor. So thanks for joining us at UroPatient.com, where your questions meet expert answers. If you found this helpful, be sure to like, share, and subscribe so you don't miss future episodes designed to support your urologic health and wellness. Hey, got a topic you want me to talk about? Let me know. We've got a email program, a button you can click on our site on UroPatient.com. Until next time, take care, stay informed, and be well. And hey, get a good night's sleep tonight.